the drug absorption. So when we say drug absorption, it is basically the transfer of the drug from, no, it is the transfer of the drug from the site of administration to the bloodstream or the circulation. So we have here a diagram, no, of the drug and the bloodstream. Before the drug will be absorbed, no, of course, it should be first, no, administered in the body, and there are different methods or different routes of administration. It can be IV, intravenous, intramuscular, subcutaneous, oral, and others. So for those drugs that are administered by IV, it is said, you know, that this particular route of administration produces a 100% bioavailability, meaning that the amount of the drug that you are going to administer is also the amount of the drug that will be absorbed in the body or that will be present in the circulation. So meaning that when you are going to administer a particular drug through the IV route, there is no loss of the drug, no, because the drug will not pass through different layers or different barriers in order for it to reach the bloodstream. Because when you are going to administer a drug, IV, it is directly the drug, no, goes directly to the bloodstream. So for those drugs that are administered or are absorbed through the GIT, there are four mechanisms whereby these drugs will be absorbed. So the drugs could either be absorbed through passive diffusion, facilitated diffusion, active transport, endocytosis, exocytosis, and filtration. When we are going to classify our the different mechanisms of drug transport mechanism, we can classify it into two major groups. The first group does not require any carrier or does not require energy, and this is known as passive transport or simple diffusion. So simple diffusion is under passive transport, and almost all drugs are absorbed by simple diffusion in the body. So about 99% of drugs or available drugs are being transported via the simple diffusion. Other specialized transport mechanisms for the transport of drugs include active transport, facilitated diffusion, endocytosis, and exocytosis. So for passive diffusion, majority of the drugs are being absorbed through this mechanism. The driving force for passive diffusion is the drug concentration gradient. When we say concentration gradient, that is the concentration of the drug in one compartment relative to the other compartment. So for passive diffusion, the drug will move from an area of a higher concentration to an area of lower concentration. So that is the driving force, no, for passive diffusion. So passive diffusion does not involve a carrier and does not require energy. So when you say carrier, that refers to a protein molecule that will aid or that will help in the transport of molecule, no, from one compartment to the other. And passive diffusion also does not require energy. Lipid-soluble drugs readily move across most biologic membranes, due to their solubility in the membrane bilayer. Again, no, for a drug to be able to pass through readily or passively through the lipid bilayer, it must have a certain degree of lipid solubility. For water-soluble drugs, they penetrate the cell membrane through aqueous channels or pores. So when we say aqueous channels, now these are um, channels or uh, channels, no, or that is made up of, for example, protein, no, such as an integral protein in the plasma membrane that will aid substances such as water, to be able to enter the cell or go out of the cell or be transported in the cell. Water-soluble molecules can also penetrate the cell via certain types of uh, pores, or most commonly they are being transported via the aqueous channels. So we have here a figure for passive diffusion. So we have here the water and water-soluble substances, urea, glycerol, and small lipids move with a concentration gradient. So for those molecules that are lipid soluble, they will be able to pass through the lipid bilayer passively. But for those substances that are such as water, again, water will not be able to pass through the cell membrane passively or via simple diffusion, so that they need a certain type of carrier or transporter in order for them to pass through the cell membrane. So in this particular diagram, the presence of an integral protein in the membrane. So in this case, this could be an example of an aqueous channel or the transport of water from the outside to the inside. So this is not an example of passive diffusion. Again, for passive diffusion, uh, the passive diffusion does not require a carrier in order for it to transport the molecules. For certain water-soluble substances, such as those having um, a size or molecular size of uh, a smaller molecular size, such as in nanometer, so they will be able to pass through the cell membrane if that particular cell membrane contains pores that will facilitate the entry of these particular molecules. So the major driving force in the movement of the drug molecules from one compartment to the other is the concentration gradient. For passive diffusion, again, the main factor here is the uh, movement of a drug molecule from a higher concentration to a lower concentration. So there are different factors that will influence the drug absorption of a particular drug. And one of that is the pH. Now, the pH of the drug itself and the pH of the environment where the drug will be subjected. So it is said that most drugs are either weak acids or weak bases. No, so a drug could either be an acid or a base. When we say acid, so acid is a substance that is able to donate or give off hydrogen ions or give off a proton. So hydrogen ion or H plus is a proton. For weak bases, these are substances that have now the capability to take off or accept hydrogen ion. So they are able to accept this particular proton. So the other term for a weak acid is it is a proton, uh, it donates proton, it gives off proton, and a base, it is a proton acceptor. So it is said that most drugs are either weak acids or weak bases. So acidic drugs are present in two forms. Now they can be present either in the unionized form or the ionized form. So the difference between the two is that the unionized form of the drug does not contain charge. From the word unionized, ionized contain a charge that could either be positive or negative, depending on the drug itself, whether the drug is acidic or basic. So in this equation, we have here HA. HA represents the unionized form of the acid, the acid molecule or the weak acid. So because a weak acid has the ability to donate or give off hydrogen ions, so when that happens, a conjugate base will be formed. A conjugate base is an acid wherein uh, it is an acid that is formed after the removal of the hydrogen ion or the proton. So in this case, we have here the A minus. The A minus is formed after the removal of the hydrogen ion. So for example, when we are going to put an acidic molecule, a weak acid, in a solution such as water, what will happen is the hydrogen ion will dissociate from water, forming the conjugate base, A minus. So the other term for the unionized form of a drug is the unprotonated form. The other term for the ionized form of a drug is the protonated form. Now from the word proton, proton refers to the hydrogen ions. For weak basic drugs, they are present in two forms, the unionized form and the ionized form. Again, when we are going to, for example, uh, put a basic solution, a base in a solution, so what will happen is that particular base will be able to accept hydrogen ion, forming this particular ion here, the BH. The BH represents the ionized form of the basic drug, weak base. And we have here the unionized form of the base and the hydrogen ion. So this part here, the BH represents again, it is represents the ionized form of the weak basic drug, or it is also known as the conjugate acid. So when we say conjugate acid, that is a base. No, conjugate acid is formed when a proton is added to a base. So in this case, the proton refers to the hydrogen ion. So because a base naturally accepts a proton, it has the ability to accept proton. So when a base will accept that particular proton in a solution, for example, that particular base will be known as a conjugate acid. So therefore, base and acids are substances that they can differ either by the presence or the absence of the hydrogen ion. So this property of base and acids is described in the Bronsted-Lowry definition of acids and bases. So this involves the conjugate acid-base pairs consisting of two substances that differ only by the absence of a proton ion. So for example, for an acid will form a conjugate base, and this conjugate base is formed after the removal of the hydrogen ion. A base will form a conjugate acid after the the base has accepted a hydrogen ion. So that is defined in the Bronsted-Lowry definition of acids and bases. So a drug passes through the membranes more readily if it is unionized, uncharged, or nonpolar. Acidic drugs are unionized in acidic medium. That's why acidic drugs are absorbed from the stomach. So the stomach normally has an acidic pH and a pH of 1.5 to 3.5. So when we are going to put or administer an acidic drug in an acidic environment, so what will happen is the unionized form of the drug will predominate so that the drug will be able to be absorbed in that particular cellular compartment. For bases, they are present in their unionized form in a basic medium. That's why basic drugs are mainly absorbed from the intestine. So normally, the pH of the intestine is higher compared to the stomach. So the intestine has more on a basic pH. So that for basic drugs, for weak bases, or for weak basic drugs, they are mainly absorbed in a basic environment because at this particular pH, an ionized form of the drug will predominate. So this particular concept is also explained by the Henderson-Hasselbalch equation, and this equation is important to predict the effect of pH change on the absorption of a particular drug. For acids, the pH is equal to the pKa plus the logarithm of the unionized over ionized form. For the base, the pH is equal to the pKa plus the logarithm of the unionized over the ionized form of the drug. So the pKa here would refer to the pH of the environment whereby the drug molecule exists in both ionized and unionized form, or the proportion of the drug molecule that exists in the ionized and the unionized form is equal to 1. So meaning that the amount of the ionized form and the an ionized form of the drug is equal. So in here, we have here a weak acid. So normally a weak acid, HA, exists in the unprotonated form or the unionized form. So it has now the capability to give off or donate a hydrogen ion to form a conjugate base, A minus. So acid is a proton donor. Proton refers to the hydrogen ion. For weak bases, it has the ability to accept hydrogen ions, so it is ionized, BH plus, and it can form uh, the an ionized form B plus the hydrogen ion. So base is a proton acceptor. The proton refers to the hydrogen ions. So this is the conjugate base. This is the conjugate acid. Meaning that the conjugate base refers to this particular molecule will be formed after the removal of the hydrogen ion. This particular molecule, uh, the conjugate acid, will be formed after the base has accepted hydrogen ions. So HH equation, this equation here, is used to calculate the percent ionization of a drug in cellular compartments of different pH. So percent ionization. So when we say percent ionization, that refers to the proportion of the ionized and the unionized form of the drug. How about the cellular compartments? What do we mean by cellular compartments? What do we mean by that? Cellular compartments. What do we mean by cellular compartments? Uh, what do we mean by that? So Henderson-Hasselbalch equation is used to calculate percent ionization of a drug in cellular compartments of different pH. What do we mean by cellular compartments? Closed parts within the cytosol of a cell. Enclosed regions. Okay, comprised of all closed parts within the cell organelles. So when we are going to apply this concept in the absorption of drugs, so we can refer to cellular compartments as those compartments such as the stomach, the intestine, the ano ba? The brain that contains a fluid, the cerebrospinal fluid in the brain, the placenta, the ECF, the blood, and others. For example, the pH of, bawa na yung pH ng stomach, particularly the gastric pH is different from the pH that is contained in the fluids of the intestines or the intestinal fluid. The pH of the blood is different from the pH of milk, for example. The pH of the fetal fluid, the fluid that is contained within the fetus through the amnion is different from the pH of the maternal fluid. And so that could refer to the different cellular compartments. So therefore, when we are going to place a drug in different environments, so that could affect the percent ionization of that particular drug. So for example, when we are going to place a drug, an acidic drug in the stomach, the absorption or the percent ionization of that particular drug will differ when we are going to place that on the intestine, when we are going to place that on the blood, when we are going to place that on the milk. Because this particular fluids that is contained within different fluid compartments or cellular compartments have different pH. So the pH of the environment can greatly affect the percent ionization of the drug. So again, pag sinabi nating percent ionization, that refers to the protonated form, unprotonated form, or the charged form and the uncharged form of the drug. So understanding how changes in pH alter the ionization of the drugs is very important since the unionized drugs cross the membrane. So only the unionized or the unprotonated form of the drug will be able to cross the plasma membrane. So again, when we are going to compute no, yung ating Henderson-Hasselbalch equation, we take into consideration not only the protonated and protonated form of the drug and their logarithm, but we are also going to consider the pKa. When we say pKa, that refers to the pH at which half of the molecules are in the ionized form and one half are in the unionized form. So meaning that the proportion of the ionized to unionized form of the drug is equal to 1. No, so 1 is to 1 yung kanilang proportion. Meaning equal yung amount ng ionized at saka ionized form at a particular pH, environmental pH. So pH and drug concentrations are logarithm-based or log-based scale. So every point difference in pH is tenfold difference in the drug concentration. So when we say every point difference in pH, so halimbawa, the pH is 1, 2, 3, 4. So every point, every 1 point difference in the pH of the environment will also increase or decrease the percent or the proportion of the drug that is ionized and unionized. In tenfold, no tenfold. Pag twofold, halimbawa from a pH of 2 to pH of 4, so magiging 100-fold yung difference. Pag ano naman, threefold, magiging 1,000. 1,000-fold yung difference no, ng drug concentration. So only the non-ionized drugs will diffuse across the membrane. Non-polar drugs are lipid-soluble. Polar drugs are water-soluble and they can be absorbed now from the biological membrane. So for the passive diffusion of drugs, so only the unionized form of the drug will be able to be absorbed by passive diffusion. So by controlling the pH of the solution and or the pKa of the drug, you can control the rate at which the drug will be transferred from one compartment to the other. So this is an example of how the non-ionized form and the ionized form of the drug or the molecule will differ according to their absorption. So in this diagram, we have here the cell membrane and we have here two compartments. For the non-ionized form of the molecule, it is able to pass through the lipid membrane or the lipid bilayer because it is lipid soluble. For the ionized form of the molecule, it will not be able to pass through the cell membrane, so that in this figure, it is trapped now in the cell membrane because it is not lipid soluble. For monogastric animals, so for monogastric animals such as dogs and humans, we have a low stomach pH. Weak acids such as aspirin with a pKa of 3.5 tend to be better absorbed from the stomach than weak bases because of the acidic conditions. So stomach has a pH of about 1 to 3, and aspirin is a weak acid. Aspirin has a pKa of 3.5, so that when we are going to administer aspirin orally, what will happen is the drug will be absorbed in the stomach because majority of the drug molecules are in the unionized form. For weak bases, they will not be able to be absorbed in the stomach because of their percent ionization. So the ionized form of the drug will predominate. So in ruminants, the pH varies with the feeds, and the pH is often at low. So usually, the ruminants has a higher um, stomach pH, that is inclined towards the basic side, so that the absorption of the drugs of those drugs that are administered in monogastric animal will differ from those drugs that will be administered in ruminants. Now, because their pH differs from each other. For weak bases, they are poorly absorbed from the stomach since they exist mostly in the ionized state because of the acidic conditions. Again, when we are going to administer a weak base orally, when it reaches the stomach, it will become ionized. So because it is ionized, it will not be absorbed in the stomach. So better absorbed from the small intestine due to the higher environmental pH in the intestine. So this is our passive diffusion for a weak acid and a weak base. Again, we have here the equation for an acid. This is the unprotonated form of the acid. This is the protonated form of an acid, the conjugate base, A minus. In here, we have here the protonated form of a weak base, and this is the unprotonated form of the weak base. This is the conjugate acid. So again, for an acid, this HA here will be absorbed. For the base, the B here will be absorbed. The BH plus will not be absorbed. The A minus will not be absorbed. The pKa here refers to the pH whereby the proportion of the unprotonated protonated is equal to 1 or equal. No, they are equal. The same is true for the weak base. The at pKa, the proportion of the BH plus and the B is equal to 1. So in here, the pKa of these two drugs is 6.5, meaning at 6.5, the value or the amount of the unprotonated and protonated forms of the acid and the base, basic drugs, are equal to 1. So our pKa here is 6.5. the the uh, the line here, from 6 to 3 refers to the acidic environment. Beyond 7, that refers to the basic or alkaline environment. So as you can notice here, the pH, the pH of the environment is less than the pKa, or pKa is 6.5. And in here, in this particular environment, the pH is more than or greater than the pKa. The pKa is 6.5. So for a weak acid, when we are going to place a weak acid drug in an acidic environment, what will happen is the unprotonated form of the drug will predominate, HA. When we are going to place a weak base in an acidic environment, what will happen is the protonated form of the drug will predominate. And as we all know, only the unprotonated form of the drug will be absorbed in this environment. So that since the predominant form of the weak acid is since the weak acid since the an ionized form of the weak acid predominates in this environment, so it will be absorbed. Since the protonated form of the weak base predominates in this environment, so uh, the drug, no, the weak base will not be absorbed. The same is true for this environment. No, in a basic environment, the weak acid becomes ionized, the weak base becomes unionized. So that the weak acid in a basic environment will not be absorbed. The weak base in a basic environment will be absorbed. Naintindihan yun? Ang ating bottom line dito is that when we are going to place an acidic drug in an acidic environment, that drug will be absorbed. When we are going to place an acidic drug in a basic environment, it will not be absorbed. The same is true for a base. When we are going to place a base in a basic environment, it will be absorbed. When we are going to place a basic drug in an acidic environment, it will not be absorbed. Or it will be trapped, in that environment. That is why we have the concept of ion trapping, wherein when we are going to put a certain type of drug in that particular environment, that drug will not be absorbed because it is trapped in that particular cellular compartment. Now, because, for example, when we are going to place this basic drug in an acidic environment, that basic drug will be trapped in that environment, and that is known as the phenomenon of ion trapping. So any questions with that? Okay, we have here an acidic drug with a pKa of 5. And we have here two compartments and a cell membrane. Now the cell membrane or the plasma membrane will separate the two compartments. One compartment has a pH of 3, that is acidic. The other compartment has a pH of 7, which is towards the basic side. So in here, we have here an acid. Acid, HA refers to the HA, unprotonated form of the weak acid. A minus here refers to the conjugate base, or it is the protonated form of our weak acid. So when we are going to put an acidic drug with a pKa of 5 in an acidic environment, what will happen is the ionized form of the drug will predominate. We have here 1, 1, 1. The proportion is 1 or the ratio is 1 compared to 0.01 of the ionized form. So ibig sabihin, at this particular environment, no, the acidic drug becomes unionized or becomes unprotonated. When we are going to place an acidic drug with a pKa of 5 in a basic environment of 7, almost basic environment, what will happen is the ionized form of the drug will predominate, A minus, so we have 100 molecules of that particular form of the drug as compared to the an ionized form of the drug, which is only 1. So notice here that we have here a logarithm of 10 or a power of 10. Now for every increase or decrease in the environment or the pH of the environment, there is also a tenfold increase or decrease in the proportion of the ionized and the unionized form of the drug. So going back to our pKa is 5. So when we are going to decrease the temperature, the pH to 3, so 5 minus 3 is 2. There is a 2-point difference in the pKa and the pH of the environment, so that a 2-point decrease in the acidity of the environment, no, from 5 to 3, there is also a twofold increase in the proportion of the unionized form of the drug and a twofold decrease in the proportion of the ionized form of the drug. No? So for example, when we have here a pH of, for example, 4, no, pH of the environment. So this could be, ilan kaya dito? Ano kaya yung value nito pag ito yung pH nito ay 4? So probably this could be 0.001, no, because there is an increase, no, a tenfold increase in the protonated form of the drug. The same is true for this. When we are going to, for example, change this into 6, when we are going to change this into 6, the proportion of the ionized form will be 10. So meaning that there is a tenfold increase in the proportion of the ionized form of the drug for every 1 level increase in the pH of the environment. That is true for the acidic drug. So pag ito ay magiging, for example, no, magiging 7, so magiging 100 ito siya. Pag ito ay magiging 8, magiging 1,000 ito, itong A minus. Pag magiging 7, 100, 8, 1,000, 9, 10,000, 10, 10,000, 11, 100,000, 12, 1 million. No, so parang ganun yung concept niya. Ito naman, pag ito ay 3, ito ay magiging 0.01. Pag ito ay 4, this would be 0.1. Pag ito naman ay 2, this would be 0.001. 0.001. So when we are going to change the pH of the environment, that will also change the proportion of the ionized form of the drug relative to the unionized form. It could either increase, or decrease the percent ionization depending on the change in the environment. Um, Again, for every 1 level pH change, it could either increase or decrease the proportion of this ionized and ionized form by tenfold. So kung 2 level increase or decrease, so that is 100-fold. Pag 3 level increase or decrease, that is 1,000-fold. Pag 4, 10,000-fold. Again, that is relative to the pKa, because at pKa, the proportion of this to this is equal to 1. So this is 1 here, this is 1 here. 1:1. Pag pKa. So in here, because this is an acidic drug and this is a basic environment, so the proportion of the A minus here, the protonated form will predominate. So pag predominate yung protonated form, it will not be absorbed, so that the drug will accumulate in this compartment at a pH of 7, or at acidic environment. So for example nito is, halimbawa ito ay stomach, ito naman ay intestine. So because the stomach is acidic, so an acidic drug will be absorbed in the stomach. Because the intestine is basic, so the acidic drug will not be, or will be trapped, or will accumulate in the intestine. So the rationale of that is, so for example, in the stomach, for example na lang in the urine, when there is, for example, toxicity due to an acidic drug, administering an alkalinizing agent, such as sodium bicarbonate, will alkalinize the urine, so that when you have toxicity due to the accumulation of an acidic drug, so in order for that particular drug to be eliminated in the body through the urine, so you need to alkalinize the urine in order for the acidic drug to be trapped in the urine, or in the acidic urine. So in this way, the acidic drug will be trapped in the environment. It will not be reabsorbed back into the circulation or into the blood, because it cannot pass through the lipid bilayer, so that it can accumulate in the urine and it can be excreted in the urine. So we also have here a basic drug. With a pK of 5. And we have here 2 compartments. The compartment 1 has a pH of 3. Compartment 2 has a pH of 7. So when we are going to place a basic drug in an acidic environment, what will happen is the ionized form of the drug will predominate relative to its unionized form. So in this example, the ionized form is equal to 100, and the an ionized form is equal to 1. So 100, 1. So mas madami yung ating unionized. So pag mas madami yung unionized, this portion here will not be absorbed. So ito lang yung magpa-pass through no, sa membrane. Ito lang yung yung unionized. Dito naman sa acidic basic environment, what will happen is the unionized form of the drug will predominate compared to its ionized form. So the same concept, when we are going to decrease further the pH to 2, what will happen to the ionized form is this will become, ilan kayo ang value nito pag ito ay 2? Ang pH niya ay 2. Ilan kayo ang value ng ating ionized form? HB. HB plus. Pag pH ng compartment ay 2, ilan kaya yung magiging value ng ating HB plus at a pKa of 5? So it is 1,000. Tama yun, no? 1,000. So ibig sabihin, when we are going to further decrease the pH of the environment, there will also be an increase in the level of our ionized form of the drug. So, for example, ito ay magiging 3. So, ito ay magiging 2 pala ito, no? So, ito ay madadagdagan siya ng ionized form. So, magiging 1,000. 1,000 ito. Pag ito ay 1, magiging 10,000. Pag 4 naman, this is 10. So, for every change in the pH of the environment to the acidic side, there is also a 10-fold increase in the proportion of the ionized form of the drug. Ito naman, when we are going to increase this further by 8, so this would be, ano kaya yung magiging value ng ating protonated form? Pag magiging 8 yung ating pH. Ano kaya yung value ng ating HB plus? Ano yung value niya? Liliit ba siya o lalaki? Ano kaya yung magiging value ng ating HB plus? Pag yung ating pH ay 8, because pag 7, di ba 0.01? How about 8? So liliit ngayon yung ating ionized because dadami yung unionized. So magiging 0.001. Pag magiging pag magiging 9, so liliit na naman siya, no? Magiging 0.0001. Kasi dadami yung ating unionized. So when we are going to place this basic drug with a pKa of 5 in a pH of 7, so it will be absorbed, no? Because basic plus basic equals absorption. So kung ito ay 6, this is 0.1, 7, 0.01, 8.001. Na naman, pag ito ay 4, yung pH natin ay 4, so this would be 10, 3, 100, 2, 1,000, 1, 10,000. So meaning, pag yung isang basic drug, nilagay natin siya sa acidic environment, the ionized form will predominate. The more that it will be acidic, the more that it will increase the proportion of the ionized form of the drug. And the drug will accumulate in this acidic environment. So nakita niyo naman dito, no, we have here the B. The B is the unprotonated form. The B here is unprotonated form. So it is able to um, traverse, or it is able to penetrate the cell membrane because it is unprotonated. So again, only the unprotonated and ionized form of the drug will be able to pass through the membrane. So an example of an acidic drug is aspirin. Aspirin are better absorbed in the stomach because stomach is acidic. So acidic, when you are going to place that in an acidic environment, it will be absorbed in that environment, or it will be able to pass through the membrane. For a basic drug, example of a basic drug is the diazepam. Diazepam are better absorbed in the intestine because the intestine has a basic environment. So basic plus basic, it will result in absorption. So this is very important. For example, in case of acidic drug poisoning, alkalinization is done to promote the excretion of the drug. So for example, when there is poisoning due to an acidic drug such as aspirin, aspirin is a weak acid. It is an acidic drug. So when there is an overdose, we can alkalinize the urine to promote the excretion of the drug. So alkalinization can be done by administering an alkalinizing agent such as sodium bicarbonate. In case of a basic drug poisoning, acidification of the urine can be done to promote the excretion of that particular drug. An example of a basic drug is diazepam. So in case of diazepam toxicity, diazepam toxicity or a basic drug poisoning, acidifying agents can be administered. An example of an acidifying agent is the ammonium chloride. So acidification of the urine will promote the excretion of the drug. Because in a basic environment, the basic drug, or in an acidic environment, the basic drug tends to be ionized, so that it will not be able to pass through the membrane, or it will be trapped in that particular compartment, cellular compartment. And in this case, it will be trapped in the urine, acidic urine. So this is another illustration of a weak acid. So weak acid. We have here the HA refers to the unprotonated form, and the A minus refers to the protonated form. So the unprotonated form of a weak acid will be able to pass through the body compartment or the lipid membrane. The protonated form will not be able to pass through. So this is also true with pareho lang yan ng weak base. Weak base, so pag protonated, it will also not be able to pass through. Pag unprotonated, it will be able to pass through the cell membrane. So importance of the environment pH and drug pKa. Degree of ionization or polarity depends on the pKa of the drug and the pH of the body fluid. So pag sinabi nating ionization or polarity, that is the amount of the ionized to the unionized form of the drug, or the proportion of the ionized to the unionized form of the drug. So pKa is the value of the drug pH when the concentration of the ionized and the unionized drug is equal to 1. If pKa of a drug is equal to pH of the media, Then 50% of the drug are ionized, 50% are non-ionized. So for example, aspirin has a pKa of about 3.8. So at this pKa, the proportion of the ionized and the unionized form of the aspirin is equal. So I think we'll have to end at this point. We'll just have to continue this next meeting. So are there any questions?